Hi, my name is Vidi Gadhiya, and I'm a student at Loyola University's Accelerated Nursing Program.
Hi, my name is Christy Brauer, and I'm also a student at Loyola University's Accelerated Nursing Program.
Our mentor for this research is Dr. Thao Griffith. First and foremost, Christy and myself want to thank you for showing interest in our research titled, Oh My Stress, Enduring Challenges for Preterm Infants and Parents During NICU Hospitalization and Parental Stress Post-NICU Discharge. So let's dive into the background of why this research is so important to overall care in the neonatal intensive care unit. 10% of infants are born prematurely, and 1 in 4 infants are admitted into the NICU. NICU hospitalization causes significant stress to infants and parents, and this stress can persist for months post-discharge.
The main purpose behind our research is to understand the stressors of preterm infants and parents during NICU hospitalization, in addition to understanding parental stressors after NICU discharge. We performed a literature review that consisted of 37 articles. Our search strategy included PubMed, CINAHL, and PsycInfo. You can find the keywords we use listed under the methods section of our poster.
In regards to the infant, our results found that complex medical care is the most significant contributor to infant stressors. In addition to this, environmental stimuli and prolonged parental-infant separation also play into the stress that the infants face. This, in turn, affects neuroplasticity, which leaves them at a greater risk for developmental disabilities, as well as an increased risk for internal injuries related to the increased stress on the infant's body. Studies have shown that kangaroo care or skin-to-skin contact can help to alleviate an outstanding amount of stress that the child faces.
Parents also have to manage stress during their time spent in the NICU as well as post-discharge. Giving birth to an infant that has to be admitted to the NICU is unplanned in most cases and can be very stressful. During care in the NICU, some of the biggest contributors of stress include the room design, access to the hospital, and psychological distress and pain, which can be found in the yellow triangles of the second figure. The stress doesn't go away post-discharge, and these stressors include PTSD, psychological distress and social isolation, lack of support systems, and fear of impaired child development and financial stress, which is in the light maroon circles.
Moving on to the implications for research and practice, it is important to understand and identify stressors for infants during NICU care. Continued research can help improve stress assessments that are currently being done on infants in order to understand stressors in more detail. Kangaroo care or skin-to-skin contact can be used as an intervention to reduce cortisol levels in infants and parents. Family integrated care is becoming more prevalent and has multiple benefits for the infant and parent as well. This style of care helps parents become more involved in their infant's care while they're in the NICU and helps parents become more attuned to their infant's cues.
It's also important to understand and identify stressors for parents during NICU care as well as post-NICU care. Continued research can help improve the education parents receive about their infant in order to understand what information is most beneficial and will lead to better outcomes. It is also important to continue research in order to understand interventions that can reduce the impact of stress. Single-family rooms can provide more privacy and help to reduce stress for parents while they are at the NICU. Screening for mental health can help identify parents at risk for PTSD, which can help with early identification and intervention. In conclusion, infants and parents experience many stressors during their time at the NICU as well as post-discharge. Trends are showing that more infants are being admitted to the NICU, which means it's even more important for us to understand how to reduce as many stressors as possible and how to reduce the negative impacts on the ones that are unavoidable. Thank you for taking the time to listen to our presentation. We hope this shines light on the importance of researching stressors in the NICU.
Thank you.